Hello and welcome to the next edition of the Primis Propositions vodcast, Hear the Lion Roar. I'm Matt Brown, Head of Mortgage and Protection Proposition, and I joined Primis in July this year. I'm absolutely delighted to be joined by my colleague Nikki Hemmings. Over to you, Nikki.
Hi all. As Matt said, I'm Nikki Hemmings. I'm a GI Proposition Manager here at Primis. As Matt said, welcome to our new episode of Hear the Lion Roar. We have a fantastic episode lined up for you today. And today we will be talking all things private medical insurance. This is a product that doesn't get a lot of airtime, so we thought that Hear the Lion Roar would be a fantastic platform for it. And I'm excited to introduce our next guest, and that is Amanda Stevens of Aviva. Welcome, Amanda.
Hi, Nikki. Hi, Matt.
Hi, Amanda.
Amanda, I am going to completely turn the spotlight straight onto you now and tell us a little bit about yourself.
Okay, so I'm Amanda Stevens. I've worked at Aviva Health for the last 14 years. My role is within field sales, so I go out to see brokers face to face, all the kind of development side, the training side, and then the new business side too. So that was the 14 years, but I have been with Aviva for quite a bit longer than that. I don't think I'll be telling you exactly how long. But it was Norwich Union at the time, which is going back some years.
Brilliant. Anyone who's got a calculator and can Google Norwich Union, then Amanda, we can probably work that one out.
It was a bit before the NU times as well, but you don't need to know how much before then, but I think that's enough information. No working out.
Love it, thanks. So we're going to get straight into your interrogation, if you like, and we're going to ask you some questions about PMI. We're really keen to, put something out there that educates people a little bit more. So I guess the starting point for today really is, what is PMI? Can you give us a brief description of private medical insurance and tell us why that product is so important?
Okay, so private medical insurance, obviously we know it's been around for some time. And what it does is it gives you access to private health care within a private facility. We know that sometimes there's been access to private beds in even some of the NHS hospitals, but predominantly there's the private hospitals. What they do is that it gives you really what I say, three different types of treatment or access to those hospitals. The first one is as an outpatient, so where you would go into an outpatient setting, you would maybe see a consultant there, maybe have some diagnostic tests, and even sometimes treatment. And we do see some treatment done in that outpatient setting. So that covers that side. We also then have what we call day patient. Day patient is where maybe you would go in for maybe a procedure, and you would maybe need a bit more supervision, which then leads us to an inpatient stay. So if you were needing something done, a procedure done, and you would stay in overnight and have your treatment and everything there, things like all your hospital charges, all your consultants' fees, and all that kind of thing is covered within that. So they're the three main parts that we see that are included in your private medical insurance policy. And in general, what we see is that the types of things that are covered under the plan are what we call acute conditions. So they're the conditions that you have where, with help from your policy, you can recover fully. So you will totally be recovered from what you've had. So for example, you've had maybe a knee operation. So we take you through from all the consultations at the start, all the diagnosis, to then having the procedure and anything that you need on the back of that. And that's what we call an acute condition. So something where we can put you back right.
Makes sense. So thanks for that. You did touch on the NHS as part of what you were talking about there. Now, we all love the NHS, of course. They do a fantastic job. We've been out clapping for them during the pandemic. But I think we can all recognise that the NHS is massively under pressure. My wife works with the NHS and I've seen the strains, that she sort of comes home with. So I guess, what do you know about what's going on in the NHS at the moment? Not to sort of put a negative spin on them, but we're talking about private medical insurance today. So what's happening in the NHS, Amanda?
Yeah, I mean, I don't think that there is really a week that goes by where we don't hear a story in the news, in the press, which relates to the health side of things, where maybe treatment within a certain area is very delayed, and it's going to take a significant amount of time to be able to get in for treatment, whatever it is that you need. Now, we know that the NHS do an absolutely amazing job, and we 100% agree with you there, Matt. You know, they've done a great job over these last year and a half in making sure that, you know, they've been able to care for us in the way they have. But we do recognise that whereas before they were, you know, able maybe to deal with something within an 18-week period, it's becoming so much longer than that. And whilst they're catching up and what even they're still treating, the COVID patients. So it is an ongoing problem for them too. So really, by having a private healthcare policy, it is, if you were to start with a new condition, it is going to give you that reassurance that you are going to be able to get in to see somebody maybe a bit quicker than, you know, what you would expect under the, you know, the current service under the NHS.
That's great. Obviously, that's given me a better understanding of PMI, and I'm sure it will have our viewers as well. So now that we understand more about PMI, tell us why it is so important. Who would you say that your target audience is?
Okay, so we have two products that we have really at Aviva that would help, there's two that I deal with anyway. The first one is for individuals. So for an individual, it may be that they may be self-employed, they may have responsibilities to look after their family. So to them, the importance of being able to get back to their normal day-to-day routines is really important, and that's where really the healthcare side, the private side of it, and being able to get that quicker treatment will really help. And so that's the individuals. Then moving on to companies as well, we know we deal with a lot of the smaller groups, and the employee benefit side of things is becoming so important to all, and healthcare is becoming a part of that. Now, for employee benefits, it tends to be a whole package. So healthcare can run alongside the things maybe they've already got in place. We know now that it's becoming quite an option that might look attractive even for somebody trying to recruit people into their company. By having healthcare as a benefit, it's a good draw. And it also means as well that from a retention perspective too, for a company, it may be good to have something like that in place as a retention tool for their staff. So it is a great thing to have within their offering of employee benefits. We know as well that from a company's perspective, absenteeism is a huge cost. And I know that on average, we see, just under maybe 5 days a year per employee being taken off. And that is probably pre-pandemic time. So I wouldn't know exactly where that was now, but I would still expect that it is still a significant cost to most employers. So the need for private medical insurance and being able to get their staff back into work quicker will certainly really, really help. So I would say those are the two main areas that we would expect a focus to be, really about those individuals with their commitments, and also then around the companies that are really wanting to enforce the benefits they've got, whilst also making sure that they can keep their staff in work and also get them back to work quicker. I think really we've just touched on the NHS there. If, for example, an employer had somebody or a member of staff that was in need of, say, a procedure, it may be that they're sat in work, they're not able to fully concentrate whilst they're waiting for this to take place. So a really important part of it, being able to get them back to work as quick as they can.
That's brilliant, and I'm sure that'll give an understanding of who our brokers can be having the PMI conversations with as well. So in your view, tell us how you think healthcare has changed, and what products Aviva have on offer now.
Yeah, I think healthcare has changed a lot. I mean, like I said, I've been here 14 years, and I think that the most changes have happened really over these last few years. We've started to see healthcare as not just being about healthcare, it's become health and well-being. So the well-being side of it being included has meant that this year on our group side of things, we've introduced things like a well-being app. So a way of an employer being able to engage their work staff into health and fitness. So make it, if they even set up targets for walking or cycling, those kind of targets that you can set personally and through your company as well. So the Wellbeing app has been a great addition. Things like digital GP, I think pre-pandemic, we didn't really hear a great deal about, maybe an online GP. And now the importance of things like that, again, really important, being able to go onto an app, get an appointment really quickly. And the FaceTime kind of situation has become so much more of a norm. And I think, that is a great addition as well to the healthcare side of things. Gym discounts, another area. We know that, on the back of the wellbeing, people are really into their gyms. The workforces are into the gyms. And what we've done is we've been able to, give them access to gym discounts, and even through the pandemic, some of the online sessions as well, to make it accessible, to the workforces and to staff under the policies. And I'm just really thinking again about the mental health side of things too. We saw some big changes to our group offering this year in around March time. We've always recognised that mental health is a really important side of what we can offer, and we had an element of the policy, but it was restricted within a limit to what somebody could get as an outpatient. From this year, we've now extended the cover that we've got under a mental health pathway, and now under our groups we have what we call a mental health pathway, which is given an unlimited pathway to people starting with a new mental health condition. So again, really supporting people with health, well-being, their mental health side too, which was really great. And also things like musculoskeletal claims, they're a really big claim spend for us at Aviva, the musculoskeletal side. And what we've done is introduced a pathway for those type of claims too, where they come to us directly. There's no need for a GP. We are then able to either, through a clinical assessment, advise whether maybe a set of exercises might help them, or whether it is that they need to see a physio, and all the need there comes without having to see a GP. And the same with our mental health pathway. The contact now is you give us a ring, we will help you. You'll have a clinical assessment and we can put you on a pathway that's right for you, with low limit to really the costs there. You're not going to be restricted. So it just makes sure that you get the real care that you need.
Thanks, Amanda. And, certainly at Primis, we are so passionate about well-being for our own employees, for our brokers. And I'm really glad you talked about mental health. It's a very real subject. There's lots of talk out there, with the whole be kind stuff, and it's okay to not be okay. And that generally is the message that we send out there. So, it's good to hear all the support mechanisms Aviva have got in place for that. So thanks for that. I guess the question, if I was a broker and I was sitting here today, I'd be thinking, is this expensive? And I think from a sort of past experience of PMI and sort of knowing what the market used to be like, it felt previously like a very luxurious product and probably came at quite a premium. What I've kind of heard more recently is it's a lot more affordable. And I guess you're the expert. Is it a more affordable product? What's your viewpoint on that?
Yeah, I would say so, Matt. I totally agree. And I can see that it would be seen as, in the past as being luxury, but it is a really great product and it gives so much. And especially when you're talking about health and the price you would pay to have that and the access to the quick treatment. So for the products that we have, they're modular products. So we basically start with a core product, which includes everything, your outpatient, your day patient, your inpatient. But we also have ways that you can either look to enhance the cover that you have, or that you can reduce the level of cover that you have. Now, we saw a really great addition this year. We call it Expert Select, but what you have when you go to see a GP, you go to see your GP, the GP will then say, yeah, you need to say, for example, see somebody about your shoulder. They will then either give you a name. So they might say, yeah, go and see Mr. Smith at such and such a hospital. He'll be able to help you with that. Or the GP will just say, yeah, you need to see a specialist, but not actually give a name. And we call that open referral. So it basically means is that you then come to Aviva with no named person and we will look for you. We aim to give you around 3 to 5 facilities that from a quality aspect are good or outstanding for CQC where we can, and then offer you, I say 30 up to 13 specialists that can actually work out those facilities and do that procedure for you. So Expert Select was came in this year, and it is a cost containment option, but I think from what I've said, there's also that quality element to it, and we're helping you really by giving you that choice of people that can do that, and everything then is all covered in full. And it's been a really great addition, and we've seen a huge uptake of that this year. It definitely has reached a part of the market, and maybe for those that you say may see it as luxurious, it's just given them maybe something else that they consider that is still giving them a really good level of care, but still retaining that quality aspect too.
Brill. Thanks, Amanda. And I guess we've talked a lot about what's going on currently. We've just touched on the past and the whole luxurious thing. But what do you see as the future for PMI? Where is the product going? What are we going to see more of, less of? Talk to us.
Yeah, and I mean, as you can see, the health product has really evolved, and even in these just last few years, and it will continue to evolve. Now, for me, I know when I sat back when we originally refreshed our products, there were really 3 areas that we felt were really important to us. And that was, one, keeping things really simple. And the second was around quality. And I've already touched on some of that quality side now. And the last about really keeping it sustainable and making sure it was a sustainable product and the pricing was all there. Now, one of the things that we have seen, and this is where I think we will see, a lot of change, is around really that quality side of things. We introduced last year what we would call a treatment network. Now, we have had networks in the past. We have a cataract network and we have a hip and knee one, which was the new one last year. What it basically does is if you come to us with one of those conditions, we will route you to a network that we have already done all the background information and work with. So what we've wanted to do is see from these networks that they have had some really good quality outcomes. So we've worked with those that can give us those clinical outcome scores, and that they're also measuring the service user satisfaction scores as well. So as well as being able to maybe offer a quality facility, these networks are enabling us to provide you with treatment that has been measured. And that's where I think we'll see a lot more changes come through. Not just being able to give you, say, a specialist that is working with Aviva, that works with Aviva and is registered with us, but also someone that is actually recognised for the quality job that they do. They've done so many procedures of that type and are really able to give our customers the best experience that they could get from having their private medical insurance policy. So that's where I think we will see changes start to come through, the real quality element starting to come through.
Thanks, Amanda. I'm sure Nikki and I can both agree you are definitely an expert in your field. We've both been nodding throughout. Nikki, I've learned loads of you.
Absolutely, yeah. Learned so much in the last however long it's taken us to record this, yeah.
Absolutely. So, yeah, thanks ever so much. We haven't had a dog barking yet, so that's really good news. We've got a few minutes left, but just in terms of thank yous from us, thanks for joining the vodcast. Thanks for talking to, we're going to put this out there to our brokers for people to watch this back. So hopefully people will learn loads about the product. And what Nikki and I would say to the network is, any brokers within the network who are not authorized to sell private medical insurance, have a word with your RSD, have a word with your supervision manager, talk to the propositions team, just get in touch with us. We can sort out what you need to do to become authorised. And then we've got Aviva and some other propositions on the panel, but absolutely, you can be talking about private medical insurance and really helping your clients. So thanks from me, much appreciated.
Thank you very much, Amanda.
Thank you very much for having me.
No problem. And we haven't made you roar, so hear the lion roar. Bye-bye.
Bye.